Hi, my name's Gavin Brigstocke and I'm a consultant orthopaedic hand surgeon. Another common condition that people seek my advice is something called Dupuytren's disease. This is actually a genetic condition that predominantly affects white men from Northern Europe, but can affect anybody. In this condition, people will sometimes notice some thickened nodules in the palm, and as time progresses, they might start to develop fingers that contract. Dupuytren's, as I said, is genetic, and often people will know other people in the family who've had a similar condition or might have had surgery in their latter stages. The physical problem is that fibrous tissue which sits in the palm of the hand, which is very similar to the sole of the foot, becomes nodular and starts to form clusters. These clusters will then develop into a cord, and in some people, the cord will start to shorten and drag the fingers into the palm. As it's a genetic condition, it can't be cured, but it also is benign and it's a safe condition to have. In the early stage, people might try splinting the hand, physiotherapy, or even rubbing and massaging the hand to reduce some of the tenderness from the nodules themselves. In the latter stage, when you have a fixed contracture, we might consider an operation. Operation can be broadly classified into two types. A fasciotomy is a procedure where the cord is divided, and this can often be done under local anaesthetic and sometimes in a clinic setting. Fasciectomy is a slightly more involved procedure where the hand is opened up, sometimes with a zigzag type incision. With this, the cord is dissected free from the nerves, the blood vessels and tendons which it may well have grown around. It's a slightly more involved procedure, and the hand will be covered to begin with and sometimes splinted into a straight position to aid the rehabilitation before all of the physiotherapy starts. Unfortunately, Dupuytren disease can't be cured, and even when it's taken out, it will recur at some point. And this does need to be considered when people first present as to which is the most suitable for you. Should you be developing this condition, I'd be more than happy to see you at any of my clinic locations so we can discuss a personal treatment plan.